The South African Health Products and Regulatory Authority has provided some feedback on the fatal case of Guillain-Barré. This is a syndrome following vaccination with J&J's COVID-19 vaccine. Now, it is a rare disorder in which the body's immune system attacks the nerves. SAHPRA also explaining the workings of the National Immunisation Safety Expert Committee. Let's get reaction now, and joining me for this conversation is the chairperson of the South African Medical Association, Dr Mvuyisi Mzukwa. Doc, good morning to you, and thank you very much for your time. I take it that you would have monitored the media briefing that was hosted by SAHPRA this morning. From their explanation, are you able to give us in layman's terms your understanding of how this syndrome comes about? And is it specific to the J&J vaccine, or is it prompted by the J&J vaccine?
Good morning to you, Polly, and good morning to your Newzroom Afrika viewers. And thanks for having me in your beautiful show. I think SAHPRA is on point. They're doing what we expect them to do, because you remember there are three pillars there. They deal with safety, efficacy, and quality of healthcare products that come in the country. So they really need to come, and explain to the nation, South Africans, that if there's anything that is suspicious or anything that has been reported or associated with, a vaccine, they need to explain to communities how it came about. On this one, the Guillain-Barré syndrome, as you correctly put it, it attacks the nerves. It's a side effect that the body just begin to attack itself, especially the nerves, where you just begin to have weaknesses of the muscles. Sometimes you could have numbness. At times you could have breathing problems. And it may lead to death. So it's something that is taken seriously, but it is a very rare side effect of the Johnson & Johnson vaccine. But it is not only a sin with vaccines. It can also be seen, with infections as well. Some infections can cause Guillain-Barré syndrome, but also some medications as well, could also cause Guillain-Barré syndrome. So the main challenge, though, with this is, I understand that there's a committee that has been appointed, committee of experts that has been appointed by the minister, and also to support SAHPRA. But I wonder if there is anything that is being done on the ground. First of all, to educate communities how to detect these side effects. Secondly, whether healthcare workers have been trained, thoroughly, to deal with these, to identify these side effects. Because you remember, those experts would depend on the report that they get from the provinces. And those reports will be coming from the healthcare institutions and healthcare workers. Are they trained to detect this? Because these are new products. So this is very important. Are they capacitated, to be dealing with side effects of these in the first place?
My goodness, Dr. Mzukwa, it's quite a serious situation. As I listen to you explain this, I'm suddenly reminded that teachers were among the sort of first few to get vaccinated because of the environment they were in. They needed to be immunized so that schools can get back into action. And I'm wondering, if you are a teacher sitting at home and you're listening to this conversation, having taken the J&J jab, not only a single but have gone back, because remember there has been encouragement to say get double dosed so that you are properly protected. Once you start experiencing symptoms, and I'm wondering whether you are aware of the symptoms yourself, who do you go to say, I'm experiencing this? What's the first port of call?
Well, we also always encourage, patients to go to the closest healthcare institution, so that there's a thorough assessment that is done by the healthcare worker, and also to assess the severity of the side effect. So then from there, it should be reported, by the healthcare worker, taking all the relevant information from the patient. But also, if you think you've got time, you can still obviously report it yourself. You can download the app that was developed by SAHPRA. But I always discourage people to assess themselves, because you'll never know. You might think it's mild, but actually it's a severe condition. So best thing is that you just go to the nearest facility so that you can be assessed there by an expert, a trained personnel who can assist you, identify what's wrong with you, and identify also stage, the condition that you are having.
Doctor, you've mentioned that this is a rare syndrome. Does that mean that of the people who have been vaccinated with the J&J vaccine or jab, only a few, or probably not even a few, perhaps 1 in a million, will experience these kinds of symptoms? Or is this something that is being picked up, which is why SAHPRA felt it necessary to call a media briefing?
Yes, maybe, Corey, let me before I answer your question, let me explain that this Guillain-Barré syndrome is an acute condition. It can't be that if you were vaccinated last year, you can then experience a Guillain-Barré syndrome. It's an acute condition. In other words, it comes a few hours, few days after you have had this, an infection or a vaccine or whatever the exposure was. So it's important that we make a note of that. But the other thing that you're talking about now is the issue of, if you look at some of the literature, it says about 21 million received this vaccine, and 108 of them developed Guillain-Barré syndrome. So in other parts of the world. So it's a very rare syndrome actually. If you compare it to the larger population that has received this vaccine. So yeah. I wouldn't want us, to scare people to say, perhaps if you got this vaccine, then you must expect to get it. Because it's like getting into the road, driving a car. We know that there's a chance that you can have an accident when you're driving a car. There's no guarantee that you cannot have an accident, no matter what quality of car you are driving.
Yeah. Doc, indeed, and I hear what you are saying, and that is important in order for people to not become anxious. However, it is important for people to get educated on the symptoms that they might start experiencing. And so the question to you is, who has the responsibility to educate people on the symptoms that they might start experiencing, and maybe just to be sure they want to be on the safe side? Who do they get that information from? And I suppose the next question next to that is, if a person does discover that I am one of those rare people who are going to be affected adversely by this vaccine, legal recourse. Are people allowed to sue?
Yeah, Goli, the person or the institution that is responsible for the healthcare system in the country is the Department of Health. Nobody else. So it's the Department of Health that is supposed to be coming up with strategies to do health promotion and prevention, including educating the communities about the side effects of vaccines. Vaccines themselves, but also side effects. But on top of that, Koli, what we need to know is that there's a dire shortage of healthcare workers. And that has an impact because how much time do you spend with the patient explaining side effects when you have a queue of patients that are waiting to see you as one healthcare worker? So this issue of numbers is very important. People can take it lightly, but it's very important. Because even with the issue of recording those side effects when you have seen or identified, it's a process that takes a very long time. So you need to have enough personnel to be able to capacitate your healthcare system so that you enable it to deliver on this issue of educating patients in terms of side effects, even health itself. When a patient comes in, you can't just be saying, well, what's the issue? It's fluid, here's medication, you're done. There's an education that comes in when you are consulting with the patient. So those are the issues that needs to be addressed by a system that actually at the moment is lacking in terms of healthcare workers.
Dr. Mvuyisi Mzukwa, let me thank you very much for your time. It's a distressing situation, but we encourage people to keep calm and just, I suppose, monitor themselves. All right, he is the chairperson of the South African Medical Association.